Holistic medical care for COPD patients. Chronic obstructive pulmonary disease, COPD, symptoms typically evolve as the condition progresses. Common symptoms include persistent cough, one of the most common symptoms, usually accompanied by thick mucus. A breathing difficulty, especially during exercise or activity, feeling short of breath. A wheezing, similar to asthma, producing a whistling sound when breathing. A chest tightness, sometimes feeling pressure or tightness in the chest. A frequent respiratory infections, such as colds or bronchitis, which can exacerbate symptoms. A fatigue. Due to breathing difficulties, patients may feel constantly tired. A weight loss, particularly in more advanced stages of the disease. COPD is a chronic lung inflammation caused by inhaling harmful particles or gases. Understanding and avoiding risk factors helps prevent COPD development. COPD is primarily caused by smoking, the main risk factor for COPD. Smoking damages lung tissue, leading to airway obstruction. Air pollution, industrial emissions, vehicle exhaust, etc. can cause COPD. Occupational exposure. Some factory workers face these risks, such as miners exposed to dust, chemicals, or fumes. Family history. If a family member has COPD, the individual's risk increases. Genetic factors. For example, alpha-1 antitrypsin deficiency is a genetic disorder affecting lung protection mechanisms. Age. As lung function gradually declines with age, aging is a significant risk factor for COPD. Respiratory infections. Frequent, long-term respiratory infections may be associated with COPD development. COPD's inflammatory response leads to abnormalities in the airways and alveoli. It's characterized by obstructed airflow during exhalation, mostly irreversible. Main lung abnormalities include 1. Airway inflammation. COPD causes chronic inflammation of the airways, damaging the inner walls, leading to swelling, increased mucus secretion, and ultimately airway narrowing. 2. Airway obstruction. Chronic inflammation and increased mucus secretion lead to airway blockage, limiting airflow, especially during exhalation. 3. Airway remodeling. Long-term inflammation causes bronchial wall thickening and fibrosis, further limiting airflow and increasing the risk of wheezing and breathing difficulties. 4. Alveolar destruction, emphysema, and lung hyperinflation. In COPD, alveoli, lung gas exchange units, are damaged, leading to reduced lung elasticity and overinflation. 5. Chest cavity changes. In severe COPD cases, lung expansion and alveolar destruction may lead to changes in chest cavity shape, affecting respiratory function. 6. Poor gas exchange. Due to alveolar damage and airway obstruction, oxygen and carbon dioxide exchange efficiency decreases in COPD patients. Diagnosing COPD typically requires considering medical history, symptoms, and a series of tests and examinations. Common methods include A. Spirometry, the main tool for diagnosing COPD. It measures lung airflow volume and speed. B. Chest X-rays can initially examine lung structure and abnormalities. C. High-resolution computed tomography, HRCT, a more detailed imaging test showing subtle structural changes in the lungs. D. Arterial blood gas, ABG, analysis. Measures oxygen, carbon dioxide, and pH levels in the blood. E. Oxygen saturation monitoring. SpO2 normal SpO2 should be between 95% and 100%. F. Exercise tests, such as the 6-minute walk test, to assess tolerance and functional status. The main goals of treating COPD are 1. Reduce symptoms by alleviating symptoms and improving exercise tolerance. 2. Reduce risk of exacerbation. Prevent disease progression and acute exacerbations. The treatment team, in addition to physicians, includes pharmacists, respiratory therapists, nutritionists, smoking cessation counselors, and others. Pharmacist. Many COPD treatments are based on inhaled bronchodilators and corticosteroids. Patients need to be familiar with how to use these devices correctly to ensure the medication reaches the lungs effectively. Pharmacists will explain the effects of different medications, such as how bronchodilators relax airways and corticosteroids reduce inflammation, thus alleviating symptoms. Patients should take medications as prescribed and not reduce or stop them arbitrarily to avoid symptom worsening. Patients should also be aware of side effects like dry mouth, headache, or palpitations. Respiratory therapist. Breathing involves many respiratory muscles, e.g., diaphragm, intercostal muscles, abdominal muscles. COPD patients' respiratory muscles become tired and strained easily, increasing infection risk. Pulmonary rehabilitation is a comprehensive intervention designed for COPD, including exercise training, health education, and health behavior promotion, aimed at improving patients' physical and psychological conditions. Benefits of pulmonary rehabilitation include reducing breathlessness, improving exercise capacity, strengthening limb muscles, enhancing daily living activities, increasing participation in daily activities, improving health-related quality of life, promoting autonomy, and improving emotional adaptation. Pulmonary rehabilitation helps patients improve respiratory function, increase exercise endurance and quality of life, and better cope with breathing difficulties and related issues. Nutritionist. Malnutrition can lead to decreased muscle strength and exercise capacity in COPD patients, potentially exacerbating lung hyperinflation, incomplete lung expansion, and airway obstruction, affecting lung function and structure. Therefore, nutritional care for COPD patients is crucial. Long-term inadequate nutrition, combined with respiratory muscle weakness, sarcopenia, decreased immune function, and increased systemic inflammation, can easily lead to malnutrition and weight loss, affecting quality of life. Patients with a body mass index, BMI, less than 21 kilograms per square meter weight are at high risk for malnutrition. The goal of nutritional care is to provide a diet with sufficient calories and protein to replenish excessively consumed energy and enhance respiratory muscle function. Increasing or maintaining ideal weight can prevent muscle weakness caused by muscle loss, improving immune function and quality of life. Cigarette smoke contains over 4,700 chemical substances, among which the harmful substances to the human body can be divided into four main categories. 1. Nicotine, the main stimulant in cigarettes. When inhaled in small amounts, nicotine excites the nervous system. It is addictive and tolerance-building, easily causing psychological and physiological dependence. 2. Carbon monoxide. When the body inhales excessive carbon monoxide, the proportion of oxygen binding with hemoglobin decreases, i.e., the amount of hemoglobin transporting oxygen is reduced, causing hypoxia. 3. Irritants. Cigarettes in gaseous form contain irritants such as formaldehyde, acetaldehyde, acrolein, hydrogen cyanide, and ammonia, which easily irritate the eyes, nose, and throat. Inhalation inhibits the function of respiratory cilia in removing foreign bodies, often causing recurrent acute and chronic bronchitis. 4. Carcinogens. Cancer-initiating substances, cancer-promoting substances, co-carcinogens, and lung-specific carcinogens. Cigarettes are the most commonly encountered dangerous substance in human daily life. The diseases it causes can be summarized into four main categories. 1. Respiratory diseases, such as COPD. 2. Cardiovascular diseases. 3. Various cancers, such as lung cancer, pharyngeal cancer, oral cancer, etc. 4. Other diseases, such as infertility, impotence, hearing loss, premature birth, miscarriage, stillbirth, etc. Quitting smoking can reduce the risk of tobacco-related diseases, increase physical fitness, reduce secondhand smoke problems, and related social costs. To encourage smokers to quit and reduce the economic burden on those trying to quit, starting from May 15, 2022, smoking cessation medication services are provided without charging for the partial cost of medications. This aims to increase the incentive for smokers to quit. Although COPD is an irreversible chronic disease, patients can still lead fulfilling lives through proper disease management and a positive attitude. First, patients need to understand the nature of the disease, accept guidance from a professional team, use bronchodilators and inhaled corticosteroids as prescribed, and maintain stable disease control. Quitting smoking is a crucial step, as it can significantly improve lung function and reduce the risk of symptom exacerbation. Through correct disease management, good habits, and positive psychological construction, COPD patients can still lead meaningful, fulfilling lives full of love and hope. Mental health is equally important. Patients can seek social support, such as joining patient groups to share experiences, which can help alleviate psychological stress. Additionally, adjusting life rhythms, maintaining a healthy diet, and cultivating interests and hobbies can all enhance the quality of life. When COPD patients experiencing gradually worsening lung function, using a ventilator is a last resort. However, long-term use of a ventilator may cause various discomforts and complications. The use of corticosteroids may lead to lowered immunity and cause pneumonia. In case of respiratory failure, not everyone is willing to accept tracheal intubation and invasive ventilator treatment to complete their life journey. Therefore, it's important to have early discussions among COPD patients, their families, and doctors about the patient's life choices. Hospice care is not about giving up on life, but about allowing life to end with dignity and peace. This is the deepest respect for life. For COPD patients, palliative and hospice care can include oxygen therapy, providing comfortable oxygen support to reduce discomfort caused by hypoxia, pain and anxiety management, using sedatives and painkillers to relieve breathing difficulties and psychological stress, comfort care, maintaining a comfortable and quiet environment, providing appropriate physical care, emotional support, offering psychological counseling, communicating with patients and families, respecting patients' wishes and needs, palliative therapies, using symptom-relieving medications such as sedatives or other palliative treatments to improve patients' quality of life. These measures can help patients maintain dignity and comfort in their final moments. Holistic treatment for COPD patients includes multiple aspects. Patient education and self-management improve patients' understanding and ability to cope with the disease. Medication and oxygen therapy can control symptoms and improve respiratory function. Lifestyle changes such as smoking cessation, nutrition management, and moderate exercise help stabilize the condition. Psychological support and emotional counseling can help patients deal with anxiety and depression. For end-of-life patients, palliative and hospice care provides comfort care, pain, and symptom management while respecting patients' wishes. We wish every COPD patient a fulfilling and peaceful life.